Well, thank you everybody for joining us today. So great to have everyone here with us. My name is Kim and I work with Dr. Lasasso and his team. We work with you guys, patients and patient parents every day to try to help you in this process. It's not an easy process by any means, both for patients and for parents. And that's kind of how this webinar series came up. So once a month, we pick a different topic and host a webinar and do a live Q&A to help answer your questions. And today's webinar is going to be our second parent roundtable. So we're lucky enough to have a group of parents with us today. These parents can be a great resource for anyone that's going through this process. They certainly have been there. I know sometimes you can feel like you're alone. We've got a team of people here that can help answer your questions and be a great resource. So thank you so much to those that are joining us today. And with that, I'll go ahead and pass it over to Dr. Lasasso, who's going to kick off our webinar today. Thank you.
Thank you, Kim. I want to take a moment to thank Kim and Kate and Allison for all the work that they do to bring this webinar series to you. They are tireless in not only their commitment to the PECTUS community, but also to me in helping me to disseminate this information and help me as those of you who are interested in more thorough information regarding the procedure reach out to me directly. So I didn't want this moment to pass without thanking them personally. And I want to welcome you all to a very stormy Edgewater, New Jersey. I'm coming to you from my home. And this, as Kim said, is the next in the series of our webinars. And we did a parent roundtable a few months ago, and it was so well received. We thought it would be a really good idea to repeat that with a different group of parents. And so I'm so happy to have this group of parents with us tonight. All of them have been through this process with their children, and I think they are just heroes, each and every one of them, in terms of the diligence that they pursued the necessary information with, and their love and their assistance in helping their children through this process. So my hat is off to all of you. You are heroes, and thank you so much for taking some additional time to share your experiences with the rest of the PECTUS community. As we have done in the past, I want to just make sure that everyone has a basic fund of knowledge. Some of you know this information by heart, others may not. So I just want to make sure that everyone who is participating has a basic understanding of what PECTUS is. I'd like to first start by introducing myself for those of you who don't know me. I was educated as an undergraduate at Yale University and went to the University of Florida to medical school. I'm doubly boarded in adult general surgery and pediatric general surgery. I did my pediatric surgical fellowship at Columbia Presbyterian Hospital, the Babies Hospital. And during the course of my attending professional career, I was introduced to Dr. Nuss, worked with Dr. Nuss, learned from Dr. Nuss. I consider him a mentor and friend. And following his mentorship, I began a chest wall deformities program at the Rady Children's Hospital in San Diego from 1999 to 2016, when I then relocated to New Jersey. Next slide. I've been doing the Nuss procedure now for over 20 years. I've done now over 1,200 Nuss procedures with patients ranging in age from 12 to 52. About 20% of my patients are adults, as defined as over 21. As I said, I moved my practice to the East Coast in 2017. I do all of my pectus surgery out of the Valley Hospital in Ridgewood, New Jersey. And that collaboration has been just an excellent one. Next slide. For those of you who will visit me, that is the main entrance of the Valley Hospital. This is my team. Allison Tan, who many of you know, is my physician assistant and my right arm. She conducts a lot of her own consultations that she does on days different than I do. She's an excellent resource for all of you in the pectus community with specific questions that you may have about our practice. Georgia, Linda, and Lynn are the administrative staff within the office, and Kate is our webmaster, and Kim you just met. Next slide. I'm going to do a bit of an overview today of pectus, and then we will introduce, excuse me, the parents, Michelle, Lisa, Bonnie, and Robert, and Ryan. They will tell their stories, and there will be a question and answer that the community can direct questions directly to the parents, and they will answer the questions that they can. If I can be of any help in the question and answer section, of course, I will be available. Next slide. So pectus is a genetic condition. It's a fairly common condition. It's seen in 1 in every 350 to 450 people on the planet. So as I like to say to patients who come and see me in New Jersey on a sunny summer day on the Jersey Shore, if you know what you're looking for, you should see someone with a pectus deformity. It is that prevalent. The genetic condition manifests itself as excessive growth of the costal cartilages. Those are the ribs that are adjacent to the breastbone in the front of the chest, and those ribs growing abnormally and driven by abnormal genetics then cause one of 3 types of deformities to occur, the most common of which is pectus excavatum. To excavate is to dig a hole, so it's a nice way of remembering that excavatum is sunken chest. Carinatum is when the chest protrudes. It's sometimes referred to as pigeon-breastedness or pigeon chest or funnel chest. And then a mixed deformity, the medical term for that is pectus arcuatum, where you, as you can see in the diagram, the upper part of the chest protrudes and the lower part is sunken. That's a very rare deformity seen in less than 1% of patients. Interestingly, this condition affects men much more than women. There's approximately 4 boys or men to every 1 girl or female that is afflicted by the condition. Next slide. So if there are no questions about that, we'll begin with Michelle, Mikey's mother, to tell her story and Mikey's journey. Michelle.
Hi, everybody. My name's Michelle, and my son is one of the oldest in this group. He's 25. His pectus excavatum was, oh, hold on, there. Hi, everybody. So Mikey's pectus became really more prevalent when he was probably 10 or a little bit older. And as time went on, it just became more and more and more prevalent. And it wasn't until just the last couple of years where he was experiencing chest pain, shortness of breath, back pain, neck pain. And it really, really affected his physical health, but it also affected him socially. So he began hiding his chest. He wouldn't swim without a t-shirt on. And so, of course, Mom wanted to do this years ago, but it wasn't until he was emotionally ready. And it just so happened that we ran into Dr. Lasasso. I had searched for months and months for someone in our own state, because we're about 3.5 hours away from Dr. Lasasso in upstate New York. And all of a sudden, there he was. And the more I read and researched not only his credentials, but his experience and the fact that he was trained by Dr. Nuss. But really what was the deciding factor was I had watched all the testimonials on the website. So as new parents looking into this, really, really, I would advise to take the time and watch all those videos, because you gain a wealth of knowledge. But especially in the patient roundtable, which is that still posted, Dr. Lasasso? Can't hear you.
Yes, it is. Yes.
Okay.
On our website, and I'll put it into the chat. We have all of the old webinars posted.
Oh, great. I mean, I watched every single one of them, and it was really important, I think, to bring your child, no matter how old they are, to watch those videos, because I watched a lot of them by myself, but there's so much information in there, and you really need to know what you're getting into, because it's a big deal. But as far as like the travel goes for us, like I said, we were 3.5 hours away. But for traveling there, what I would really recommend is finding a nice hotel close to the hospital, because Dr. Lasasso's office is right here, the hospital's right there, there's a slew of hotels. Spend the extra money and get a nice hotel, because you can't get into ICU until 2 o'clock in the afternoon. So you don't want to be going out for breakfast, lunch, and dinner. So if you can find a place that's nice and comfortable and it's got amenities, it's going to be really helpful to you. You'll be more rested for when you do go to see your child in ICU. But let me just say that we would have driven to California to see Dr. Lasasso. And if I had one sentence to say for this whole webinar, that's what I would say, because the research that I've done, the people that have gone to other surgeons and who have had failures, and Dr. Lasasso, you'll see that in webinars, he's actually had to correct procedures done by other surgeons who have completely, you'll see, I'll just save that for you. But really, it's just, I can't even put it into words how amazing it is. But so as far as the travel, make sure you find a hotel that's close to Dr. Lasasso so you can go back around. And then for the second thing, the pre-op testing, we spent months trying to get all this stuff done before we even had an appointment. But really, we had wasted a lot of time because some of the testing that was done up here wasn't adequate. So we had to repeat some of the things, like the stress test was supposed to be a VO2, and they didn't do that on their thing. So we had to have the whole thing done over. So personally, if I had to do it over again, I would say take the 3 days, go down there. They have a team of cardiologists and the patch testing for the metal test, all the testing that you need to do, it's all right there, and they have everything set up for you. And if you can just take 3 days, it is definitely worth it. And it's so much less stressful on you. Plus, New Jersey is pretty nice. They got some great beaches. So as far as insurance, we didn't really have any problem with insurance, and Linda was fantastic doing the prior auths for us. So that really wasn't an issue for us as far as insurance goes. But then the big one was the surgery. And that was tough. The surgery itself was okay, but when I walk in ICU and I see my son with his arm over his head like that, I said, "Mikey, what are you doing?" And he goes, "Oh, I feel great." Dr. Lasasso will talk about the nerve block that he gives, which lasts, was it 72 hours? Well, once that wore off, bam, he felt like he was shot in the chest. And we had a bit of a struggle trying to get his pain wrapped back around and managed. But that was a big thing for us. But of course, Mikey's older than a lot of the other people that are getting the surgery. So he had a little bit more of, I would say, healing because, well, you'll hear from Dr. Lasasso about the cartilage and how when you get older. But so last thing, I don't want to eat up my time, but the post-op thing, the first week going home was really tough. It was tough. And it was 24 hours a day, managing that pain, trying to stay on top of it. And what worked best for us is having him sleep in a recliner was really helpful because Mike is a side sleeper and we were so afraid he was going to roll over on one side. So we kind of kept him in the recliner with his feet up, and that really helped a lot. And if you can take the time off from work when you get home after that week of surgery, that is so important because you really need to be there to manage the medications and stay on top of the pain and encourage them to get up and walk. And that was one of the best things outside of all the pain relievers was getting him to get up and walk, because when he was in pain, he would clench all up. But when I could get him up and walking, his chest would relax more and then he could kind of walk through the pain. And that was really one of the best things that we had. So thanks again, Dr. Lasasso. You are unbelievable, amazing, and you're just really an angel on earth. And thank you to Allison. She was always at our disposal, always answering me, always helpful, walked us right through everything, and the team is just unbelievable. So thanks again.
Thank you, Michelle. Thank you so very much. I think we'll talk about individual issues once everyone has presented, but I definitely do want to talk a little bit about the nerve block and Mikey's response to it, which was wonderful initially, and then we needed to really pursue a plan B. So we'll talk about that a little bit more. I'm sure people will be interested in that part of your story. So we'll next go to Lisa, and her son is Will.
Hello, I'm Lisa Fedorowicz, and we had Will's surgery back in June, this past summer, June 24th. And Will, he, at his 12-year-old physical, his pediatrician noticed that his chest caved in, and he said, well, I think we should refer you to a surgeon because he has pectus. And I had no clue what pectus was at that point. So then my whole research started kicking in of trying to figure out what is pectus and how best we could help Will. At the time, we were referred to our local, we're in Connecticut, and we were referred to our local children's hospital where we met with a surgeon there. She did an overview and told us, you know, he definitely would qualify, that he wouldn't have an issue with insurance because she could tell just by using a popsicle stick to measure that his chest was already deep enough. But she did say that we would have to wait because he was still going through a growth spurt, and she wanted to wait until he was around 14 or 15 years old to do the surgery. So I knew I had some time. So I started to do some research. I talked to the pediatrician and I said, well, we've met, you know, with the local hospital. I said, you know, it was okay. It wasn't like fabulous. I wasn't like, oh, wow, she seems like the right fit. He said that we should go for a second opinion, and a lot of his patients that had this, not that he had a lot of patients that had it, but the ones that he did had gone to Shriners up in Springfield. So we made an appointment at Shriners and we went to visit them, you know, it was probably at least a year after the initial appointment at the locals hospital. And when we went to Shriners, the doctor was basically telling my son, you know, this is an optional surgery, you know, you don't have to have it. It's not necessary. And I, in my heart, was like, I think we need to know what's going on inside, because at this point we hadn't done any testing inside to find out how it was affecting his heart or his lungs. And for the doctor to say right away that it was optional, I was like, well, maybe it's optional and possibly it's optional, but I'm not 100% sure it's optional. So I kept researching, and on Facebook, I was on some pectus groups, and Dr. Lasasso's name had popped up. Some other names had popped up too, but I kept researching and it kept bringing me back to Dr. Lasasso. So I went on and long story short, I made an appointment to have the free consult with Allison. And by this point, I want to say he was 13 and he had grown quite a bit at that point. And Allison had gone over, this is what would happen. You would come down, you would meet with us, and we'd go over everything, and we'd explain everything to you and all the steps. And she went very detailed into all of the testing that we would have to go through. Both of the other doctors that we had met with had never really said, oh, you're going to have to go through all this testing, and these are the different tests that you'll have to do. So as soon as she was going through everything and telling me everything that was required, I felt like they had all their ducks in a row, and they really knew like what was going to have to be done to make sure that my son had a successful surgery, and everything was researched before they did the surgery to make sure that this was medically necessary and that they were doing it the right way. So for my comfort level and for the best surgery for my son, we made an appointment with Dr. Lasasso and we met with him. And as soon as we left there, I looked at my husband and I said, this is where we need to be. So we need to somehow make this happen, because I knew that the end result was going to be the best for my son. And that's all I really wanted to have, because when somebody's putting bars over your child's heart, you just want the best for them. You want it to be successful, and you want it to be as painless as it can be. Clearly, it's not going to be painless that much, but you want the experience to be the best. So we met with Dr. Lasasso. They came in with a folder, and Allison had all of the little sheets, and I, numbered what had to be done when, in what order. And, we had to meet with this doctor, and we had to have the cardiologist, and all of these things were like in order. So I knew that that was the place that we needed to be. And we talked about what could be done locally and what would be best to be done in New Jersey. And it worked out really well that we could have some of the tests done here in Connecticut, and then we went to New Jersey. It was just a few times. I think it was a total of the initial visit, and then a visit right before, and then a visit when we went to the hospital, and then a post-op. So it really, maybe it was 3 or 4 visits to New Jersey, but 2 hours is worth it. And the experience of the surgery itself, I think for me, the worst part was the waiting. Just having to wonder, am I making the right decision? Is it really truly necessary? When we went to the cardiologist and we had his stress test done, his heart was getting affected, and they put him on a beta blocker. And I think for me as a parent, as soon as that happened, I knew that that was a sign for me that this surgery was necessary. So the end result was, when we went for surgery, his Haler index was 11.2. He needed 2 bars put in. His surgery was 9 hours long. It was not a simple surgery. It was pretty complex. But the process itself with Dr. Lasasso went really smooth. And I think for me, once the surgery was over and he was starting to recover, I was feeling so much better, because yes, he was in pain, but we were now healing, and it was healing pain, and it was easier to deal with than the anticipation of, am I making the right decision for my son? Dr. Lasasso and Allison were great in the hospital afterwards. My son had a really rough time. The day day after surgery, he was throwing up the entire day. It was the medicine was just too hard. Narcotics were too hard on him, and we didn't know that. And as soon as they came to visit, Dr. Lasas was like, we're changing this up. And as soon as he changed it up, everything turned around for him. And he was really able to bounce back really quickly, much faster than I ever anticipated. And he's done fantastic. You know, he's gone through 8 weeks of physical therapy, and I know not everybody does physical therapy, but Dr. Lasasso's office has a great physical therapy regimen that they share with your local physical therapist so that they can use that to help your child. And I think that made a huge difference for Will. He's not athletic, so having that really helped him to heal. And he's really thrilled with the final results. And we didn't go into it because we didn't, you know, the cosmetic. He was at a point where he was not wearing a shirt anymore when he was swimming. He wasn't embarrassed. He was like, oh, well, this is what it is. But as soon as we knew it was affecting his organs, we knew that it was something medically necessary to do. But he's thrilled with the results, and we're all thrilled with the results. Now, as far as like his recovery went really smooth, and we were very lucky, and all of that, and everything's been really smooth. Insurance clearly is another thing that we're kind of dealing with now. My insurance worked out that the hospital's covered, the doctor's not. So we're still working through with the insurance. They paid for a chunk of it, but not all of it. So we're still working through it. But Dr. Lasasso's office has been great to help us out and work with us as far as trying to put appeals together and all of that kind of information. So I think in the end for me, whatever it was going to be, it was worth it because I wanted to have my son in really good hands. So we're very pleased with the results.
Thank you, Lisa. That was an excellent summary of a very, very long-standing journey, years in the making. And I think you did a wonderful job. Thank you so much for sharing that.
You're welcome.
We'll now go to Bonnie and Robert, who will discuss their son, Nick, and his journey.
Hello.
Hello.
Can you hear us?
Hi, guys.
Hi. Nick had his surgery in May on the 20th, and he's doing great. It's been 5 months, but it's amazing, really. He's doing so much better. In fact, he had an allergist appointment. They said he had 1 liter more of air in his lungs. That's what they told him. I'm like, wow, that's incredible. So, but he started his journey, I'd say, like when he was around 10. We realized that, well, first of all, we had pectus in the family, but we didn't know it. One of his cousin was kind of evaluated, and when we found out that he had it, then we started going, oh, that's why it looks different. And, you know, there's a problem here because it started progressing like around maybe 12 or 13.
Yeah. And
we realized that we should try some different, so we tried exercise, we looked into the vacuum bell and some other things, therapies, and nothing would really work. We went and saw another expert, and he suggested, actually that's where we found out about Dr. Lasasso. He's like, you know what, you really need to just go get surgery. There's nothing else that's going to fix this. So he was the one that recommended Dr. Lasasso's office, and that's how we started researching him. But we looked at a lot of other people too online, and it was kind of scary actually seeing all the different people's journeys. Like the pain was what scared me the most about the whole thing, because I have a friend, her son had the surgery and it was a terrible experience, and he was in a lot of pain. So that I wanted to find somebody that was very experienced and had better pain management of the whole process.
Yeah, I mean, that was a big concern of ours. And when we found out about Dr. Lasasso and that he was in New Jersey, we were so excited because the idea that he could be anywhere on the East Coast was an amazing thing, because all of the doctors we saw online, some of them were 1,000 miles away or across the country. and none of them had the qualifications that Dr. Lasasso has. So this was an amazing thing to think he's really there. I mean, we're really going to be able to make this work. And one of the things that I did with Nick was, my son Nick, was to go through the testing after we had visited and talked to Dr. Lasasso and Allison. We were really excited about it. It was during COVID, obviously still is COVID, but it was a real difficult time as far as getting appointments, and we wound up doing it up here in upstate New York. And I agree also that we would do that now. If we could do that over again, the testing we would do down in New Jersey and just go down for a few days and get that done. But that we did get through all the testing, and we realized that yes, he definitely is a candidate for the surgery. And that was something that, that was kind of a really good thing to get that testing and to get the results.
I want to say that the team that Dr. Lasasso has in the office, but also they're awesome. Help with insurance, they were always available. We asked a million questions, we emailed, they were always there to answer anything we might have had, and we were very reassuring about our concerns. And also the pain management group that they work with, because that was one of our big concerns, was they were terrific. I mean, we had a phone consultation with that office from our house, and the doctor was really kind of funny, actually. He helped us feel calm about it, and reassured us about gave us all the names of the medications, explained everything to us so we would be prepared for when he had the surgery. And the hospital was great too. I want to mention that because he does work with Valley Hospital, and they had like a patient coordinator there for us the day of surgery, and she was, they gave us a special spot to sit. They were wonderful. They kept us up to date on everything. Allison called us a couple of times on the phone to let us know, because it was about an 8 or 9 hour surgery, which is a long time to wait and just be nervous about it the whole time. So they kept checking with us to let us know, like, he's at this stage, he's at this stage. So we knew it was progressing well, and they were like, he's doing great at this point. And so I think everything, it kept us calm, first of all, and reassured us that everything was going the way it was supposed to. The big thing for all us, I think, is just getting the right person to do a surgery. You just got to get the best. If you got any kind of physical problem, I feel like just getting the best medical person involved is the way to go. So it was a wonderful experience as far as, it's a big deal, but Nick's very happy too. He's thrilled about his chest.
Yeah, so it was kind of a long journey, but because we saw Nick progressing, and we weren't sure if we could fix it or not. And once we got through that surgery and we went through this process, it just pinched ourselves to say, we really got through this, and we found someone who really knows what they're doing. We had lots of confidence after our first visits, and that confidence was rewarded with an excellent surgery and an excellent outcome. And after the surgery, Nick was in pain for a few days. For a few days you're not in pain. He wasn't in pain, but he had some pain. I don't think it was as bad as we were expecting it to be. I think some people have different experiences, but it was not. It was managed very well. The hospital, the nurses were terrific, and we wound up going to a hotel for a few nights, and we used the pillow. That's a big deal. If there's a wedge pillow, I highly recommend that. We bought one that was adjustable. You could take a piece out of the middle of it, so you could make it shorter. And we had that at the hotel room to try to help him, keep him elevated, because you're supposed to do that. And he's still sleeping on it. And many months later, he's just comfortable like that on that pillow. But if you don't have, I don't know, that was the one hard part, is going to a hotel rather than your own home is a little bit, he felt so much better when we finally got out of the hotel and returned to our house. But maybe that was the one little thing about traveling that was a little difficult for a couple of days till we got his final checkup, and then we were able to drive home. But yeah, thankfully there are good hotels nearby, and quite a few, and so that made it more comfortable, and that worked out well too. So it's been a wonderful experience. We're so lucky that we found Dr. Lasasso and Allison and the whole group.
Thank you, guys. Can you speak a little bit about, because I know that Nick is a runner, he's an athlete, he enjoys sports. How did his recovery during the physical therapy phase of care go? And how's he doing now in terms of, his returning to an active lifestyle?
Well, he's not a really official runner, but he does run. The physical therapy was really good. We found somebody, like one of the other parents said, locally, that we gave him the plan that you guys provided, and we told them like the things he does, like he bikes and he runs and things like that. They asked what things does he do, so they could tailor it a little bit more to him. But he did 8 weeks of the physical therapy, which was great. And he bought like rubber stretchy bands and things that they recommended, which he's doing on his own now at home. He does them. He's pretty good about it. He does it like every day, at least, maybe every other day sometimes. And the walking and all of the things that they told him to do, he did them. And I agree with the other parents. They have to get up and walk. Allison kept saying, yes, you need to walk every single day. He needs to increase it. Like he started at 15 minutes and then it went to 30 minutes. And she said, as much as he can do is good, as long as he's not in pain. And all those recommendations worked. He's even hiking. He was even hiking in the Adirondack Mountains. I mean, not the tallest peak that there is, but very, very long hikes. And I think before the surgery, that would have been a real challenge for him, the breathing and having to rest. He didn't have to rest. And it's a real life-changing experience, that he has stamina now. It was like probably a month later, he started hiking. Like it was like he was careful, but I was like, are you sure you up to that? And he was really going. And now he's been doing bigger hikes. So all the stuff recommended as far as exercise after, they really have to do that. It's really important.
Thank you, guys. Thank you very much.
Thank you.
Now we'll go on to Ryan, who will discuss his journey and that of his son, Bennett, who was 14, I think, at the time that we operated.
That's right. Yeah. So I guess we're a little bit more on the unique side in that we happened to luck out. When my son was born in the hospital, the pediatrician came to visit a couple days after he was born, and as luck would have it, our pediatrician actually had pectus, and he saw, it wasn't really obvious, but there was a little dent there, and he just happened to tell us 2 days after he was born, hey, it looks like your son probably has pectus excavatum. It's very, very mild, but this is something you want to keep an eye on as he grows. And he advised us back then, especially through puberty, because that's when it tends to get worse if it's going to get worse. So I feel like we're very, very fortunate in that manner that, a lot of folks that I see online, they tend to not know what it is until later in life. And even on the parent side, they don't know what this dent is. They just thought this was a dent that they had. This is the way their body is. I've seen a lot of people on the Facebook and Reddit community that get into their 20s and then they find out that there's actually a name for this dent in their chest. And, it's just shocking to me that it's just so, it's not commonly known what this is when it's so prevalent, I guess. So my son turned 12 and the dent started to deepen a little bit. So we started to kind of put the wheels in motion and do some research. At that time, I joined a couple of Facebook communities. I think there's about 4 or 5 out there. I was in about 1 or 2 at the time. They were extremely helpful, but they were also, they increased the anxiety on the parent side, because a lot of the stories that are shared there, as with like reviews for restaurants, people go on there and tell the negative experiences because they're looking for help. So we were very anxious about getting this procedure done. And nervous to get it done because of the negative stories we heard about this. we saw our first surgeon. We're in Connecticut. We went up to a couple states over to see our first surgeon. Nice folks. I think they had done a combined, between the team of two, a combined 120 Nuss procedures in their history since I think the late 90s. We saw another surgeon closer to us that had done, I believe the number was 30, which, neither one of those numbers made me feel comfortable. And actually, before we even saw the first surgeon, and Dr. Lasasso, I don't know if I told you this before or not, but we actually looked at you, and we got a little bit nervous because of the stories on Facebook with insurance, meaning that you're an out-of-network provider. Insurance is covered a little bit different than if you go to the guy down the street. So we didn't even reach out to you guys until after we saw the next two surgeons. But the amount of Nuss procedures that those other two had done, while they may have been fine surgeons, it just didn't give me a comfort level that I needed. So in doing the research, going to pectus.com, speaking to finally Allison and then Dr. Lasasso, we learned that Dr. Lasasso had done over, I think it's 1,200 Nuss procedures at this point. He trained under Dr. Nuss himself. With this level of intensity for the surgery that needs to be done and for the specialty that's required, that's the one thing that made us feel comfortable, was the fact that Dr. Lasasso had done over 1,200 procedures. So we pulled the plug on the other two surgeons, and I guess before we did that, the first surgeon had him go in for a CAT scan when he was about 12 and a half years old. That showed a Haller index of, I think it was about 2.8 a couple years ago. The second surgeon actually did an X-ray to get the Haller index. We had visibly seen that it had increased, but the number they gave us was a 5. And I know that the X-rays aren't always the best way to tell, but obviously there was an increase there, a significant increase in that depth of the dent. And then that was when he was 13, almost turning 14. So that was January of 21 that we found out it was a 5. In just a little over a year, it had almost doubled in depth. And then we went to Dr. Lasasso, and thankfully, like one of the other parents said, we didn't actually go through a lot of the other specialists to see, the cardiologist and pulmonologist and all of that, because we didn't do that then. We were lucky that Dr. Lasasso told us, these are the guys you go to, but don't only go to the cardiologist, but get this specific thing looked at, and don't just get a stress test, get this specific stress test. And even the allergy, the allergy doctor for the metal allergy, it wasn't just go get tested for metal allergy, but get this specific allergies test, which not all the dermatologists do. And it's very, specific to the metal that they're using. So we got all those tests done, and then we had the MRI done, and we were shocked to see again that his Haller index increased from initially at the age of 12 and a half, a 2.6 or 7, I think it was, to a 6.7 a year and a half later. And that was just before he had surgery. He had surgery August 20th of this year. We were able to do all of those specialist visits within probably a month and a half before the surgery. I think the biggest surprise for us was, we went through all the specialist appointments and assumed that everything was kind of pointing towards the surgery happening on the initial date that we had scheduled, which was August 10th. And the insurance company actually denied the procedure. Dr. Lasasso's office actually managed an appeal for us. And I think it was August 9th, the night before the procedure was scheduled, the insurance company at like 6 or 7 o'clock at night said, nope, we're not going to approve it. We had to then postpone the appointment for the surgery. We postponed it a couple of times, and Dr. Lasasso's team was very, very good about working with us and also working for us as our advocate. We wrote letters of appeal. They wrote letters of appeal. I think what finally pushed us over the edge was the company I work for is a larger company. And I went to the HR management team at my company, found out that we're what's called self-insured, meaning that we kind of fund our own claims because we have such a large population of employees. And when you have a self-insured company, a lot of times your company actually decides what claims are going to be paid and how they're going to be paid. So they had a board meet on my son's situation, and they gave the approval. We never actually technically got the approval from the insurance company. We got it from the board of the company that I work for, my employer. And they were, again, just very, they were very sensitive to what we were going through. They saw that there was a need for this, and they said it's ridiculous that the insurance company denied this. So for folks out there that work for larger companies, if you ever do get that denial, talk to your HR team too, because I think it's a pretty helpful route to go. The day of surgery finally came on the 20th. Initially, we were kind of upset because we were hoping that, he'd have a couple weeks to recover before school started. None of that really matters. The fact that he's in the optimal age of, I think it's 14 to 16 when the chest is more malleable. The age of 14 to 16 is where he had the surgery. That seems to be the optimal age. We got him in for the morning of surgery. Obviously, the parents, both of us are at the end of our patience and nerves and so on with the situation. We were just kind of put at ease with the fact that Dr. Lasasso's team was so great. Allison Tan actually gave us a suggestion to ask the pain management team or the anesthesiologist, I guess, to give him a little Valium beforehand because he was kind of getting anxious. That was a great tip. The second he had that kicked in, you could see him just physically calm down, and they had to wheel him away, so we can't go into the OR with him. Then it was 7 or 8 hours, and like one of the other parents said, we got a hotel room nearby. We booked it for a week. We just kind of waited that 7 hours for the surgery to be done. Your team was fantastic again, in that they reached out to us a couple of times as well, giving us progress reports throughout the surgery, which was amazing and very helpful to us. When we finally saw him in the afternoon, he was, coming out of anesthesia slowly, but when he finally came to, I think we're, again, very fortunate that his pain level was very, very low. On a scale of 1 to 10, I don't think he ever said it was more than a 5. The pain blockers that we had for him, they wore off, I think 72 hours. I think one wore off after 24 hours and the other was 72, if I remember right. He got a little bit of a peak in pain after each one wore off, but none of it was extreme. And based on what we had heard from other folks that had this procedure done, we were just blown away with how well he was doing. So because of that, I've decided to try to be as active as I can on the Facebook and Reddit community, because there's so many, unfortunately, and it breaks my heart every time I see one, there's so many negative stories out there about how procedures went wrong. I think it's important to tell this side of the story as well when you have a good experience, the same thing that one of the other parents said before. During that 7 hours of waiting during the procedure, I kept on questioning myself. My wife was doing the same thing. Are we doing the right thing? Is this necessary? My son actually didn't have a lot of side effects because of the pectus. He didn't have the breathing problems. He didn't have any restrictions really, which is probably why the insurance gave us such a hard time. So we had to do a little bit of a dance with the insurance company on that piece of it. But everything that we saw and the increase in this dent over a 1.5 year period, all signs were pointing to, if we don't do this now, he's going to have these symptoms later on. So over the next couple of weeks, I think he was off all of his pain meds with the exception of Advil after a week of surgery, which again, just kind of blew our minds. He was up and walking around. He felt great. He had one setback when he was kind of just playing too hard and did too much stuff, probably about 4 or 5 weeks after. That just took a couple of days of rest and some Advil, and he was fine. And we're now 9.5 weeks post-surgery. And man, you just never know that he had the procedure done if you weren't aware beforehand. A couple of things that I'll throw out there for what it's worth, just my recommendation. When folks are looking for doctors, first of all, when we actually switched pediatricians because we moved, and the new pediatrician had told us that his pectus was not that severe and don't get the corrective surgery because that's only a cosmetic thing. It's amazing how many professionals, how many doctors and surgeons and so on will give that advice. This is solely a cosmetic thing. It's not. Read the stories, read people's situations. It becomes very, very clear very quickly. This is not cosmetic. It's something that if you have the means to do it, you should absolutely do it. The other piece of advice that I'll give is when you're talking to surgeons, don't be shy. Don't let them lead you into whatever direction they want to go to. Treat it as you're interviewing them. All right. So ask them very specific and pointed questions. Ask them how many Nuss procedures they've done in the past. Ask them how many of those were successful, meaning how many regressions that they have after the surgery happened. How many were, failures, if you will. If the surgeon is honest, trustworthy, good, they'll be quick to answer those questions. If you have a surgeon that's kind of dancing around those, I would get very skeptical and I would probably run if I were you. I think it's with a specialized surgery like this, where not a lot of doctors do it, it just makes sense to go with the best. I see a lot of people online saying that they went to their local thoracic surgeon. That's a great first step, but that doesn't mean they're a specialist in this specific procedure. Most of the times when I'm on Facebook or Reddit, a lot of the issues I see are with folks that went to somebody local that doesn't have the experience and they're paying for it. Unfortunately, again, it just breaks my heart when I see it. So my goal is to get out there, talk to as many people as I can, offer up whatever advice I can. Not to say that I'm an expert by any means, but we've been dealing with this for 14 years and we've kind of found ways to weave through the muck, if you will. So the one other thing that I'll point out is my son had pain where the bars are below the skin and above the ribs. And we found this, I don't know if you can see it. This is just something that my father sent to us. It's called Lord's CBD cream. And it's almost instant. It just took away the pain almost immediately. So it's more of a topical pain. Doesn't work for the very deep pain, but for the topical stuff, I thought that was a great solution. He asks for it whenever he has irritation, and it just almost instantly goes away in those spots where the bars are above the ribs. So for whatever that's worth, I thought that was pretty helpful for him. Just looking at my notes, I think that's basically everything. Dr. Lassasso, you were fantastic to deal with. It's not very often that you get a specialist or a surgeon that has the compassion that you have. That's not the most important part for a surgeon, but man, it sure helps, And Allison was fantastic through this journey. Your team is, your office team has been just so helpful, and you're just changing lives. We just appreciate all that you've done for us and the way you go about doing what you do. So thank you.
Thank you, Ryan. Thank you.